Hello and welcome to Healthwaves podcast. I'm Eilis, your host and nutritional therapist. Many of us are familiar with going in and out of our local pharmacy. They're very well positioned. They're great support for overall health. Today I am joined by Liz O'Hagan of Meaghers Pharmacy, who I was so happy to see have introduced this 360 approach. The 360 approach is a very holistic approach. When people are going in to get their prescriptions or maybe repeat prescriptions, they will chat to the customers about what's going on in their lives and maybe see if there's other supports that they can give them. Yes. I'm really delighted to hear all about it today from yourself, Liz, and you're welcome to come on the podcast.
Thank you for having me today. Pharmacy 360 is all about integrative health. And what that means is you've got your regular Western medicine, conventional medicine, but then we really want to look at lifestyle health and other services to pull it all together and offer the patient the best for them and really individualize it per each person.
People are so familiar with going into their pharmacy. They often get to know their pharmacists and the assistants behind the counter.
Yeah.
And it's a great opportunity to, like, you have all these people with conditions coming into you.
Yeah.
So you're just so well positioned. I suppose it's a great opportunity, isn't it, to get to talk to them. You and I both have a lot in common with the underlying cause and lifestyle and what's going on in people's lives. And maybe we were meant to come together on this podcast.
Yeah, because we actually did meet before, but didn't realize it when you sent me the message. Back in Christmas 2019 in Austria, in a ski resort, I was working over there and you were on your holidays with the family. So our paths have already crossed.
I think maybe we were meant to meet again.
Yeah, it's come full circle to be here now today.
So. I would have been halfway through my nutritional therapy at the time. And you were a ski.
I hadn't even started the journey of learning about integrative health and lifestyle. Okay. That all came after the pandemic that really shone a light on the issues we have in our healthcare system. I've been working in community pharmacies for over 13 years. You see the same patterns evolve with certain chronic illnesses. You just see it happen before your eyes. I got to a point where I was like, we need to do something to try prevent this. I felt it wasn't enough just the prescription, dispensing what was on it and handing out the medication without offering people more. So like if I try to imagine that every customer is like a family member or a friend, and what would I want my mum to get advice for if she was going to a healthcare provider? So I try to give that to everyone, but obviously you're one person and you can't do it all. Pharmacies across the country are overrun with high volumes of prescriptions and customers. And, there's a lot of, it's a real reflection of society at the moment. There's a lot of around, and a lot of them are really, fueled by things like stress and the pace of our society, until we slow down and look at the bigger picture. What really is going on in our day-to-day lives, from our relationships, our nutrition, our exercise, why we want to be healthy in the first place. Yeah. That's what the 360 approach to the person is.
Yeah.
So that's what we're really trying to focus on.
I love that we are trying to look on each customer as a family member. But as you said, you're really busy as a pharmacist.
Yeah.
It's difficult to implement an approach like that.
Yeah. It is a challenge to try and change when people are set in their ways in certain ways. But with this, with Meaghers and Pharmacy 360, we've brought in leaflets on 7 elements of health. Where each leaflet is bite-sized information, very simple, and all of it is things you can do at home that are free. And it's things a lot of people would know already, but it's gentle reminders, bring people to pause and reflect on their own health and the different aspects of it. Yeah. It's not just a pharmacist-led thing. They've given me the opportunity to run with it, and they've 10 stores across Dublin.
Brilliant.
And in all the stores now are these leaflets. Everybody in the whole pharmacy team can offer them to customers. Yeah. Customers can take them while they're waiting and have a read. On the back of each leaflet, there's a QR code that brings you to the website and blogs on each of the 7 elements as well.
I was looking through those blogs. They're really informative. They're very well put together, and I loved all the information. It's actually quite similar to information that nutritional therapists will give out on lifestyle interventions. So I really loved. Are you implementing this then across all the branches and among the staff in all the branches?
So I went around the stores when we first launched the leaflets and the concept behind it.
Yeah.
I'm in one of the busiest stores in their Kinvara branch in Dublin 7, just off the Navan Road. Some days it's go, 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 but it's important to take that extra moment and give the customer that extra bit of time because they really might need. From the feedback that comes back, it gives me great job satisfaction to know when I've done something that has really helped somebody. A huge part of the integrative healthcare that we want to implement is signposting to other healthcare professionals like qualified nutritional therapists, dietitians, and physiotherapists.
For all of us.
It's what will suit that person, and every person is going to be different. So it's to try and individualize it, offer people the knowledge that these services are there, and then it's up to them which they pursue. But to give them an opportunity to educate themselves and feel more empowered when it comes to their health, that's what I'm really passionate about.
Yeah, absolutely. And you just said there, everybody is individual. And I think that often gets lost in healthcare because, you know, you could have somebody coming into you maybe who's maybe something like high blood pressure or pre-diabetic or diabetic, but their condition could be driven. One person, it could be driven purely by diet, by high sugar, but another person, it could be driven by stress.
100%.
So I love that individual approach.
Because then if it's from stress, that person's going to benefit from a little bit of breathing exercises, a bit of mindfulness.
Yeah.
It could be bringing in exercise to relieve stress. Could be high blood pressure from their diet, drinking water.
Well, it could be just multiple coffees a day, or it could be deeper.
So as much as we need the medication to keep us healthy and safe and well, and longevity and everything, but unless we look at the root cause, we're kind of just putting a Band-Aid over it. And that really frustrates me.
I think this is where we're both very lined up the same, because absolutely, if somebody is in pain, if somebody is at risk of high blood pressure or whatever, bringing down their symptoms, that then gives them a chance to look at what's going on underneath.
Yeah.
Rather than going back and just repeat.
When people get prescribed medicine, they might leave with a bag of tablets and feel like they're getting their health externally. They need something to take to keep them well. Whereas I think by educating, in particular with lifestyle health, diet, nutrition, exercise, sleep hygiene, stress management, it empowers the person to be like, they're taking the reins up and taking control back on their own health. And that's really important because without that, you give up a little bit.
Sleep is a huge thing, isn't it?
Yeah.
I'm always trying to think which one is the most important in terms of sleep, exercise, stress, or nutrition. And it's very difficult. But I think if you don't have your sleep sorted, you can't really implement the other things.
Yeah,
so
it's the anchor that kind of holds it all.
You have to have that in place to put the other things in place.
Yeah, for sure. With Pharmacy 360, will I go through the 7 elements?
I'd love to go through the 7 elements. They're so interesting.
The first one is your core values and why you want to be healthy.
I love that. It's so different.
The course I did in integrative health and lifestyle was through the University of Arizona, the Andrew Weil Center for Integrative Health and Medicine. And it was the very first module we did, and I didn't know what to make of it. Some people call it spirituality, but that can scare some people off. But core values, it's really why you want to be healthy. Like, what's the point of it all? It's a very simple exercise that I've often encouraged everybody to do. I do it myself every couple of months just to refocus and get a blank piece of paper and write down, why do I want to be healthy? It's for nobody else to look at. There's no wrong answer. I remember struggling to write anything at the beginning because I was like, obviously I want to be healthy. But then you start to write down things you want to be able to do that you need your health for. By the end of it, you look at it, maybe even a day or two later, come back and read it. You realize you've written down everything that's important to you. And it's a real motivator and driving force. Once you have that kind of purpose and drive, it's easier to implement subtle changes into your day-to-day routine that will ultimately make a much bigger impact in time.
Yeah, I love that. I suppose it clarifies in somebody's mind why they might want to make some changes and gives them more reason and purpose to do it rather than kind of, oh, yeah, I know it's better for my health. It's a little bit similar to one of the questions on a nutritional therapist questionnaire. How would your life change if all these goals were to be met? It makes people visualize maybe, oh, well, it would mean that I can go out with all my friends and hike more or whatever it is. It gives people more of a visual or a deeper understanding.
Yeah. But the next element is sleep. It really is the anchor to everything. So many of my friends have young babies at the moment, and you know, it's just hugely important from mental health point of view and physical health, energy levels. I've heard sleep described as emotional first aid. When we're in proper sleep cycles, our brain processes events that have happened. It's hugely important for bodily functions and repair. If anybody wants to take a look at the blog, there's some links to some podcasts by Tom Coleman, sleep expert in Ireland. There's so much information you can learn through that blog. You can learn a few lifestyle tips and things you probably know, but just little reminders. There are links to get further information if you want to learn more.
I wonder if everyone you see in the pharmacy business, even if they all slept really well, I'm sure even on medications, it would have an impact on how they're working on you or whatever. So then next up after
stress management, we put as the third element. Stress fuels so many chronic illnesses. It causes inflammation in the body. The physical as well as the emotional effects can be detrimental. Unfortunately, we live in a society where stress keeps coming back at us. It's not like we can just erase it. It's how to manage it and what we can do each day, whether it's pausing for 2 minutes in the morning and focusing on your breath. That's a form of meditation, or for some people it can be praying or chanting. What relieves your stress? Turning the shower to freezing cold at the very end for 10 seconds or 5 seconds. That can reset the nervous system. There's loads of little things that we can do. We've just finished the stress module and we're about to move on to our next element, which is nutrition. We're going to be getting dietitians on to our Instagram page and lots of different people to speak about nutrition, whether it's with children, adults, menopause, or different areas. I'll have to refer people to your podcast now as well.
Absolutely. Nutrition can help with so many different areas. It's just brilliant. And these are in leaflet style pamphlets for the customers.
If somebody came in and they're newly diagnosed as a diabetic and they don't know where to start, this leaflet on nutrition will be given to them with their prescription and they can bring it home. There's a lot to take in with a new diagnosis and have a read through it. I hope people know they're welcome to come back to the pharmacy. Every single pharmacy in the country has a private consultation room and you don't need an appointment. It's free. To help with the GPs as well, because the GPs are totally overrun at the moment. We're all individual people. We need to work collectively as a team with all the other support networks out there, like qualified nutritional therapists, dietitians, physiotherapists, people to get moving again. Like, talk about issues as well, like counsellors, psychotherapists. There are so many amazing people out there.
Amazing people, and there's room for everybody. And the chronic conditions are on the rise. I saw some stat recently that there are 1 million people in Ireland suffering with an ongoing chronic condition. For such a small country, that is a really worrying stat. But I love as well that you're signposting these people to other services.
Because we can't do it all. Pharmacists and pharmacy teams, we're not the expert in everything. There is a lot we do know and absolutely come in and pick our brains for that. But there are areas I don't have the time to sit down, unfortunately, and talk through a nutrition plan with somebody. As much as I would love to do that, the job keeps ticking over as well and we need to provide care to everybody. So you're kind of against the clock in a way. And you're trying to find that balance and that sweet spot where you can provide really good service, but also leave people feeling like they can learn more and get help in other areas where necessary. And that's why the QR codes in the back of the leaflets have been great. It's bite-sized information on the leaflet. If you get that spark, a bit of curiosity, then they can go and learn more. Oh, there's a podcast. I might go for my walk and listen to this podcast and actually learn about my health while I'm out and doing my exercise, which leads us nicely to the next element, which is movement and exercise. Exercise releases all the happy hormones, the endorphins. What antidepressant tablets try to do is literally what exercise does. Life can be very tough on people. We get at certain periods struggle and need a crutch to get us going again. And medication can be life-changing for people and so needed. But also, if you want to see the best outcome from taking these types of medication, exercise is crucial. It should be prescribed, like exercise 3 to 5 times a week to start. If you walked 10, 15 minutes off the road and came back and did that 5 times a week, amazing. That's your exercise. Swing your arms, get the frustrations out.
It sounds so simple,
And it can be really hard for people to get up and do. Think about it and you procrastinate. The hardest step is literally putting the runners on and taking that first step, which brings you back to the core values and to really just go back and read why you're doing it and why you want to do this. And the last two elements are connections and relationships. Like we all saw during the pandemic when people were cut off from social circles, how much it impacted their mental and physical health. Lots of people really declined in that situation, and loneliness can be really toxic. Loneliness was comparable to smoking a lot of cigarettes a day, like the detrimental effects on health.
Right.
A lot of people can give up. It is really sad. But then there are incredible communities around, whether it's from sport, active retirement communities in most areas around Ireland. Like there's men's sheds. My mum is part of the over 50s youth club. They love it, and it's so social. Keeping people active in the community actually affects your health.
The blue zones always talk about that. The areas in the world where they're the most centenarians and health in old age, they always talk about community.
And an integrated community where young people are dealing with older people and, you know, both learn from as much as the young people can help the older people with technologies, and older people can teach young people from life experience.
It's more, and I think that's where in the blue zones they found that the families, that there's old people and young people and babies and everyone sort of mixed, that it's healthier.
Yeah. And the final one, the seventh element, is the environment, whether that's our internal environment or the external environment around us. A lot of our external environment is out of our control, like water quality, air quality, and things like that. But it's really trying to see the benefits of nature in healing. When we relate it back to our health, getting into the fresh air if possible, getting into a forest or an area with lots of trees, the air will be cleaner there. Trying to get into the elements like the wind blowing in your face and just feeling the energy of that, the sound of the waves or even the rain. The impact of nature on our health has a huge healing effect. It can be hard in cities. You have to be more creative in those situations. Can you bring plants into your apartment? Can you put on like ocean wave sounds before bed at night? Like they have such a relaxing effect. So try to get a little bit more creative with that. Also, there's eco-anxiety around climate change at the moment as well.
Oh, absolutely.
And that's a huge I've seen young people really concerned about climate change causing anxiety. They might be on anti-anxiety medication, and you know there's lots of different struggles there, and they feel hopeless and helpless. There are amazing charities out there that people could connect to. There's one called Friends of the Earth. It's a worldwide organisation, but they do have a base in Ireland, and they're always organising gatherings and different events, even guest speakers that would talk about certain issues, or even just to subscribe to their emails and feel like you're part of movement.
You're adding something rather than feeling helpless.
People from every age, every area, all sorts of backgrounds. And it's like, well, what extra step could we do to just point them in a direction that they might kind of get the ball rolling? You know.
Brilliant.
So that's Pharmacy 360 in a nutshell.
It's brilliant. Wouldn't it be great to see this rolled out if this became commonplace in all pharmacies?
It's preventative healthcare. And
I know.
You know, anyone I speak to, other pharmacists and GPs, we all want this. People are experiencing burnout in healthcare. We need to be really mindful about, you know, it can be so easy to give out about our healthcare system, but people in it are really trying hard.
They're working so hard, but they're stuck.
So I think we need leadership. If this was a sports team and you're losing every match, what would the management do? They would look and invest in their juniors. That's what Dublin GA did, sure.
Yes,
you look at the young people and the juniors.
Yeah.
Personally, I hope to someday go into schools and speak to the younger generations and try to like embed these lifestyle, simple, sustainable habits into their lives, and they can bring it home to their parents and their families and then their children in time. And I think it's going to be a real, like we need, and to really it as a healthcare system, not a sick care system or a disease management system, which it kind of is at the moment. And it's look at it with a new lens of the simple implementations we can do and use all the other experts out there, like yourself.
We have to come together,
collaborate
work together. There's room for everybody. Once somebody is well qualified in their area, you have people you can recommend, they're well qualified. My vision, if I could control what goes on in there, would be that people like dietitians, nutritional therapists, like myself, acupuncturists, and all the different therapists would have a directory of ones they know they can trust in their community. They could hand these names out And even better if they had one or two within a practice or clinic with a more holistic approach where you'd have your GP and other practitioners.
Center,
That'd be super.
Imagine you were getting your prescription and have a chat with a dietitian or nutritional therapist about
cholesterol. They may still need their medication, but their medication is going to work better. They may be able to reduce it. Their overall health is going to be better.
And they'll feel better. And everything we're talking about is to complement.
Bringing it all together for the better health of the individual.
And that's what we need to keep remembering, why we're doing any of this. It's that one person. Always have to bring it back to that one person. And it's really hard to change in a busy environment, but you do your best and you try to connect with people when you can. There'll be days where you can't. And through Mars, they've given me a great opportunity is to share what I know and my knowledge with the whole team. Like they've over 20 pharmacists and loads of amazing technicians, OTC staff. This is all lifestyle stuff. It's not very technical. It's simple. So everybody can share that information. We had a 97-year-old woman. I was doing her blood pressure check and it was a little bit high, as we all can get when you sit down to get your blood pressure checked, a bit tense. So I was like, right, we're going to do a little breathing exercise. But the first one was done, it was a little high. So I was like, we're going to relax, and the 4-7-8 breath. So in through the nose for 4 seconds, hold for 7 seconds, and blow out through the mouth for 8 seconds. On the exhale, try relax your shoulders, and if notice are you holding tension in your fingers, your jaw, little things like that. It was almost like a little guided meditation. Jeez, feel nice after that. A little bit dizzy. And she loved it so much. Before she goes to bed now, she came in just telling all her friends about it. It's something so simple, free. Wow. We all have access to it. I just want to share things like that. Sometimes when people struggle, we say take a deep breath in, everything gets tense, shoulders go up, tummy smaller, your lungs smaller. But if you just said to someone, smell the flowers and go, you take such a clear breath, and they blow out a candle in the distance. In the pharmacy, if any of us are getting a bit stressed or it's very busy, you'll hear people shouting, smell the flowers now, smell the flowers, and blow out candles.
That's brilliant.
And it's so simple. But notice it yourself. Just take a deep breath in through the nose.
It's a much calmer breath, And even as you're speaking, I'm realising I'm hardly even breathing as we're having this conversation. And I think we've all forgotten how to breathe, and we do this sort of shallow breathing.
And we're breathing through the mouth where we should be breathing.
The breathing, it's just so simple.
And vitally, I'm reading the book by James Nestor. Breath. I'm actually listening to the audiobook. It's on Spotify at the moment, and it's fascinating. I'd really recommend if anyone likes an audiobook. It's mind-blowing, all about the difference between nasal breathing and mouth breathing and how it impacts your health.
And I'll put that on my list of books that I have to read on health. Your kind of vision, your overall vision, where would you love to see this going, this pharmacist holistic approach? Where would you like to see it?
If I make the dream big, it would be that every pharmacy in the country offers things like this, and simple lifestyle tips on better sleep. You could put it into Google and it'll throw the facts back out at you, but trying to link it to the prescriptions and pair them in a complementary way, sleeping tablets, lifestyle sleep. It's as simple as antidepressants. It would be things like core values and stress management, exercise, movement, nutrition, relationships, and connect. To be honest, it's all of them, because everything affects us. We're like this jigsaw that we're not whole without one piece. It can be very overwhelming, and there's so much you're like, I don't even know where to start, and then you just don't start. So it's like a volume dial. She described it as tweaking the volume up on one and tuning it down on the other. This week I'm going to focus a little bit more on my nutrition, reduce my processed foods, make sure I'm drinking at least 2 litres of water a day, and only have 1 coffee in the morning if I really want my coffee. If I want an afternoon coffee, I'm going to choose decaf or a tea, a herbal tea, or something
like small steps to accumulate rather than taking it all in. Anyone can go home from the pharmacy and Google sleep. But they're going to get millions of stuff. They're just going to be totally overwhelmed. You don't know what website you can trust, what website is backed up by science, or where to start. So I think that's where people trust their local pharmacist. They trust the information they're getting. It's brilliant that they can go home and know that what they've got in this leaflet is trustworthy. Real information. It's not just coming from God only knows who. And I think that's really valuable.
Financial stress is huge on people at the moment. This is something that we're trying to get the information out there to educate and empower people. The things that we're talking about aren't costly, like going to bed at the same time each night and waking up at the same time in the
time,
morning,
yeah.
or reducing screen time in the evenings. These aren't things that are going to cost people.
I know.
Going out walking, like obviously it'd be great if we can all join a beautiful gym with a swimming pool, but it's not going to be feasible for everyone or accessible.
There's somewhere everyone can walk.
And if you can't get outside for health reasons, there's links on the exercise and movement page for yoga videos, very gentle things that are on YouTube that are free. You know, people that don't have the confidence to go to a gym, or to go outside exercising. Like there's so many different areas that people come from, and we try to have something for everyone. And there's an incredible program called XWell Medical in Ireland, run by Dr. Noel McCaffrey. I'm so passionate about it because
he's local to here.
Even my village at home in Balscadan, North County Dublin, I've seen such a shift in the whole community. There's a centre in the Knoll in the football club. It's not done by a certain age. It's done by if you have a chronic illness you're living with, something health related. You have to be referred by a doctor or a pharmacist.
It's very easy to get referred.
And
you don't even have to make an appointment to go to your GP. You can
and
walk into
a lot
your
of people, you go on the website and there's a referral form that your healthcare professional pharmacist, your doctor can fill out for you. That's where they get consent and medical history. You send that off to XWell through a secure email network, and XWell contacts the patient directly, brings them in for an induction, make sure that everything they're going to be doing is safe for them and for their ability. It tailors it specifically for them. The exercise classes cater for everybody. I've seen the camaraderie, people older, younger, going through different treatment programs, everyone carrying their own cross. The community spirit. Half the time, Mum goes with some of the girls.
So the XWell sounds brilliant, and it ticks more than the movement box in your elements of health. It really fills the gap of community, the camaraderie, as you said.
They change it depending on the season, but if it is outdoors, that's going to help your sleep. Well, it'll help your sleep anyway.
So it's ticking nearly all the boxes.
And you're also going to be more conscious of your water intake, what
your nutrition. Well, you're not going to go and eat McDonald's after being
I think there's sometimes talk about coffee and a little sweet treat after, but you have to enjoy yourself, and it's all about balance. They would be more conscious about eating protein after working out. And
we're all going to be chatting together, boosting each other, and probably swapping different bits of health advice, which is brilliant.
And you get that renewed sense of gratitude for what you have then as well.
This has been such a brilliant conversation, Liz. Lovely to hear about the approach. I'm very optimistic when I hear about these kinds of approaches, and I wish you all the best with it. I hope it's a great success for Meaghers Pharmacy, and wouldn't it be great to see it rolled out among all pharmacies and that this will be the norm. So lovely chatting to you today, and thanks a million for coming on.
Thanks so much for having me. Thank you.